Hi everyone, it's Dr. Matt coming to you live, well, I guess not really live, from my home, or as I like to call it now, my fortress of isolation. Well, yeah, I'm on quarantine here in my house, lockdown, so I had a bit of extra time and I thought I'd throw a little video together and chat with you guys about the coronavirus. As I'm sure you're all aware, we're on the cusp of a looming pandemic known as the coronavirus, and there's a lot of stuff out there floating around. A lot of it isn't true. There's a rumor going around that if you can hold your breath for 10 seconds, then you don't have the coronavirus. And this, I must say, is an absolute total fiction. Thank you very much, Geraldo Rivera, for that nugget of stupidity. But this is totally false. So I thought I would use this time to clear up a little bit of that misinformation, talk about the coronavirus, what it means for us here in Masset, and talk a little bit about what we can do as individuals to help out. So what is the coronavirus? Well, to starters, it's a virus, and like the common cold, there is no cure for coronavirus. Because it is a virus and not a bacteria, antibiotics won't help. The only thing we can really do is take some Tylenol or some Advil for our symptoms and let our bodies do the healing and get rid of the infection. It's important to remember, though, that this is not the normal flu because it kills a lot more people than the normal flu. Based on what we know from China, most of the people who get coronavirus will get better at home without any need for treatment. And this seems on the surface like good news. At this point, this is kind of where things start to get scary. On the island of Haida Gwaii, there are roughly 4,500 people. From that, if the virus is allowed to spread, 3,600 of us are going to catch the virus. Of that 3,600, 720 people are going to get sick enough to need hospitalization. Let me say that again. 720 of us are going to get sick enough to need hospitalization. That's scary, especially when you consider that between both the Masset and Charlotte hospitals, we have a total of 12 beds. That's 12 acute beds, most of which, by the way, are usually already full with people who are sick for other medical reasons, so we'll have less than this. As a little bit of a demonstration, I spent a couple of hours counting beans. They're not quite to scale, but imagine each one of these beans represents someone who needs to be in the hospital. 12 beds, 720 beans. Of these 720 beans that need hospitalization, 36 of them are going to require invasive ventilation. And that means putting in a breathing tube and keeping them alive on a breathing machine. We have 2 of these machines on island, one in Charlotte and one in Masset. No matter what we do, half of these people are going to die. Even if we are able to get them on planes, send them to the fancy ICU in the big hospitals on the mainland, half of those people would still die. But in all likelihood, every other ICU is going to be filled with people in the same situation, and we will be unable to get most of our people off the island. On top of this, our hospital is still going to be struggling with all the regular medical issues that we normally have, heart attacks, motor vehicle accidents, and all that kind of stuff. Then to make matters even worse, a number of us healthcare workers, physicians and nurses are bound to get sick. Well, good people in Masset, do not panic and do not lose hope, because we're still at a point where we can potentially avoid this worst case scenario. And it's not going to be the nurses and doctors who do it. It's going to be you, if you're up to the task. As community members, the most important thing we can do now is try to stop the spread of the virus. Imagine this yellow line is basically how much our hospital can handle in terms of sick people. If we don't do anything, this is what's going to happen with the cases. The cases are going to well surpass our ability to cope. So the idea is that if we're able to control the spread, we can lengthen that curve out and never go beyond our capacity to cope with the number of sick people. So that's the goal. This is also known as flattening the curve, and that's what we're hoping to do. We want that curve flat, flat, flat. And that's where you guys come in. We know from witnessing what's happened in other countries that the elderly and the people with complex medical problems are the people who are most likely to get really, really sick. And this is because as we get older, our immune systems don't work quite as well. Those little white blood cells in our body that help protect us against things like bacteria and viruses and vegetables. I'm just kidding about the vegetables. That's good. When we're young and healthy, our immune systems are strong and they can kick serious butt. But as we get older, our immune systems just get weaker and aren't able to fight off bacteria and viruses the way they used to. So even though many of you might be young and healthy, we all really need to step in to protect each other in the community, especially the most vulnerable people like our nannies and our chinnies. So you might be asking yourself, what if I don't feel sick? In truth, most of the spreading is done by people who are infected but don't have any symptoms. So you might get infected and not actually have any symptoms for up to 1 to 2 weeks. And it's during that time that you're most likely to unknowingly spread the virus to other people. It can be spread through saliva, snot, sneezing, coughing, when all that goop comes out, and like touching things. So every one of us needs to be aware of what we're doing with our hands. We gotta try not to be touching our faces, our mouths, picking our nose, especially if you haven't just washed your hands. I did just wash my hands. Even in our own houses, we have to remember to wash our hands often and be careful about what things we're touching, especially if there's somebody else in the house who might be sick or more vulnerable. We need to flatten that curve. So we know that the virus is mostly spread through contact. So one of the ways we can help prevent the spread is to stay away from each other. I know it's hard, especially for some of us with that animal magnetismo, but it's something that we need to do, especially you lovebirds out there. I see you. You need to do this because we're all depending on you to help keep everyone else safe. So a little bit more about social distancing. Essentially, it means giving people space. You're trying not to touch things. You're not going over to people's houses. You're not going to the store unless you really need it. You're not sharing drinks. You're not sharing smokes. You're not sharing doobies. No tongue wrestling. No funny business. And I know that really sucks, but it's not for long. And this is really the best thing we can do to keep everybody in the community safe. So really, please try your best. So maintaining the social distance is going to be extra difficult when people start to get sick and get flu-like symptoms. But please do not go to the hospital if you have flu symptoms. Stay home and take some Tylenol or take some Advil and do what you can. Like I said before, antibiotics aren't going to help it. It's something that your body needs to ride out. And essentially, you should only be going to the hospital if you're starting to have trouble breathing or you're basically worried that you're going to die. If you are thinking that you need to go to the hospital, please call this number. This is Northern Health's COVID information line. There's nurses and doctors and nurse practitioners who will be able to answer this phone and give you advice on what you should do. If they tell you that you should go to the hospital, then please come to the hospital. But call this line first. And take it from me, social isolating for a little while isn't as bad as it seems. There's still a lot of fun stuff you can do, such as
read a great book, do some karate, put on your hockey equipment, then keep doing karate.
have some special alone time.
Maybe learn to skateboard.
More alone time. The list is basically endless. Oh, and don't forget about Skype, FaceTime, and Vid. Basically, what you need to do is just stay away from people. We need to flatten the curve. We need to flatten the crap out of this curve. And it's up to me and you and everybody in Massa to look after each other. So be a hero. Keep your distance, wash your hands, stay home, and save some lives. Being a real hero has never been easier. This is Dr. Matt signing off from my house of isolation. Hang in there, everybody. We'll get through this, and I'll see you guys on the flip side.